Hello dear viewers. Today, we will focus on a growing and often overlooked issue in our society, prescription drug addiction. For many of us, the medications prescribed by our doctors are a tool to improve our health and quality of life. However, the misuse or long-term use of these medications without medical supervision can lead to a serious addiction problem. In this video, we will discuss what prescription drug addiction is, its symptoms, risks, and harms, while also emphasizing that patients using their medications under medical supervision should not worry unnecessarily. Prescription drug addiction, as the name suggests, occurs when medications prescribed by a doctor are used outside the dosage and duration recommended by the doctor, for their euphoric effects or for other purposes. This situation causes the medication to deviate from its intended purpose and leads to serious health problems. So, how do prescription drugs become addictive? Some prescription drugs affect the reward center in the brain, causing the release of dopamine. This creates a pleasurable feeling in the person, and the desire to experience this feeling again forms the basis of addiction. Over time, the body develops tolerance to the drug, meaning that higher doses are needed to achieve the same effect. This triggers the addiction cycle. What are the symptoms of prescription drug addiction? Here are some signs to watch out for. 1. Using the medication more than or more frequently than prescribed by the doctor. 2. Using the medication for purposes other than the condition for which it was prescribed. 3. Experiencing withdrawal symptoms when trying to stop the medication, tremors, sweating, restlessness, insomnia, muscle aches, nausea, vomiting, diarrhea, etc. 4. Lying to doctors or trying to obtain the same medication from different doctors, doctor shopping. 5. Experiencing problems in social relationships, work life, or school due to medication use. 6. Constantly thinking about medication use and spending most of the time obtaining or using the medication, which prescription drugs can be addictive. The most commonly addictive types of prescription drugs are as follows. We are generally referring to active ingredients here. 1. Opioid pain relievers. Powerful pain relievers such as oxycodone, hydrocodone, morphine, fentanyl, tramadol. 1. Although these drugs are effective in relieving pain, their long-term use carries a serious risk of addiction. 1. Overdoses can lead to respiratory failure and death. 2. Anxiety medications, benzodiazepines, medications such as alprazolam, Xanax, lorazepam, Ativan, clonazepam, Klonopin, diazepam, Valium. 2. These medications are used to relieve anxiety for a short time, but their long-term use can lead to addiction, impairment of cognitive functions, and an increased risk of falls. 2. Serious withdrawal symptoms can occur when stopped suddenly. 3. Sleeping pills, hypnotics, medications such as zolpidem, Ambien, Esopiclone, Lunesta. 3. These medications can temporarily solve sleep problems, but their long-term use can lead to addiction, memory problems, and daytime drowsiness. 4. ADHD medications, stimulants, medications such as methylphenidate, Ritalin, Concerta, amphetamine, dextroamphetamine, Adderall. 4. These medications are used in the treatment of attention deficit hyperactivity disorder, but their misuse can lead to addiction, insomnia, loss of appetite, anxiety, and psychotic symptoms. The potential harms of prescription drug addiction include 1. Physical health problems, liver damage, kidney damage, heart problems, respiratory problems, weakening of the immune system. 2. Psychological problems, depression, anxiety, psychosis, suicidal thoughts. 3. Social problems, deterioration in family relationships, failure in work or school life, financial problems. 4. Legal problems, obtaining or possessing medications illegally. 5. Overdose and death, especially overdose of opioids and benzodiazepines can be fatal. Important section. Use under medical supervision. I want to emphasize a very important point here. If you are using a medication prescribed by your doctor for a condition, at the dose and duration recommended by your doctor, the risks we mentioned in this video generally do not apply. Your doctor has determined the most appropriate dose and treatment duration for you and is monitoring you closely. If you have any concerns about the possible side effects of your medication, you should definitely share them with your doctor. Never change your medication use or stop your medication on your own without consulting your doctor. Open and honest communication with your doctor is the best thing for your health. Prescription drug addiction is a treatable problem. Treatment options include 1. Detoxification, the process of cleansing the body of the drug. 2. Psychotherapy, helps to address the underlying causes of addiction and develop coping skills. 3. Medication therapy, some medications can be used to alleviate withdrawal symptoms or prevent relapse. 4. Support groups, meeting with people experiencing similar problems provides support and motivation. If you or someone you know is experiencing a prescription drug addiction problem, seeking professional help is very important. You can get help by consulting a doctor, psychologist, or addiction specialist. Remember, asking for help is not a weakness, but rather a sign of strength. Have a healthy day. See you in our next video. And don't forget to subscribe to my channel and like this video.